Hello everyone. Today's video is another Q&A video talking about a few questions today about heavy metals and chelation therapy, and then also a question about the Safe and Sound protocol. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if at some point you wouldn't mind quickly posting a comment, a like, share, subscribe on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. So first question here is, can you just explain the difference between calcium EDTA and disodium EDTA? And then just a couple of other words here about chelation therapy being important, and thank you for the extra words there. So basically the big difference between calcium EDTA and disodium EDTA is that the calcium EDTA has a couple of the binding sites already occupied by calcium. So disodium EDTA, if it's administered too quickly into the body, it can rapidly deplete calcium levels in the blood. It's very, very dangerous, causing rapid hypocalcemia, and it's really dangerous. And unfortunately, there's been a couple of case reports of individuals actually dying from that being done because they gave the wrong form of EDTA as a rapid administration. So very tragic and unfortunate medical errors that happened there a couple of times. So therapeutically, it's like, well, why would you even have disodium EDTA? If you have calcium EDTA and it's way safer, why even have disodium? Well, sometimes we want to use the disodium EDTA when we're dealing more with cardiovascular concerns, or if we're really trying to enhance circulation for some reason. So the calcium EDTA, which is the form that you can administer, that can be administered very, very rapidly because it won't cause hypocalcemia, it's a very, very good form at getting rid of lead in the body. Cadmium as well, half decent at getting rid of mercury, helps to bind up certain other heavy metals as well. It does have some anti-biofilm effects as well. So if there happen to be biofilms in the bloodstream, it can potentially help with that. Maybe help with bladder biofilms, maybe, but that would be a very extreme way of going after bladder biofilms. So that's really what calcium EDTA does. Disodium EDTA does all of those things as well, but it also has an effect on nitric oxide production in the blood vessels. So it can activate this enzyme called nitric oxide synthase, which causes more nitric oxide activity in the blood vessels and ultimately causes the blood vessels to expand. So folks can notice that if they have high blood pressure, their blood pressure can go down. They can notice improvements with their overall circulatory function. So maybe, just signs of better blood flow, like maybe their limbs are warmer, maybe their energy's better, maybe their brains seem to be sharper because they're getting more blood flow delivery to those, vital tissues. There's also the calcium binding component of the disodium EDTA that can actually potentially be therapeutic. So sometimes there's calcifications in the blood vessels, possibly as part of plaques that are in the arteries. There can also be calcifications of like there can be aortic calcifications, for example. And so I've actually had patients where they had, notable calcification, and then that calcification actually got better over time using the disodium EDTA. So we have to be really careful not to administer it too quickly, because it would be very, very dangerous to do that. However, it can actually be, it has all these kind of additional therapeutic properties over and above the calcium EDTA. So that's why we use it. We always make sure we run it over at least 2 hours, generally better to do over a 3-hour period. So it's a lot longer to administer than the calcium EDTA, but when we're looking for those therapeutic benefits, then it's maybe worth it to spend the extra time. So thank you for that question. Next one here is a really, really good question. I would have this question too. So it says, what about the EDTA in Propel drink powder? I drink quite a few of these packs a day. Is the amount added to protect the flavor, it says in parentheses here, enough to seriously affect my calcium levels? So a really good question. So my understanding is the amount of EDTA that's present as a preservative in different foodstuffs is very, very, very small. It's a super minute amount. And so even from that perspective, it's not going to meaningfully do really anything in the body from like a chelation perspective. The other thing with EDTA is that it is very, very, very poorly absorbed through the intestinal tract. So even if it was a high dose, it would be just impossible to induce hypocalcemia, to my understanding. So very, very safe. But yeah, EDTA is used as a preservative in some foodstuffs and drinks. So if you see it on the label, it's like, oh, there's EDTA, that's EDTA, but won't meaningfully chelate at all. So not an issue, thankfully. And then it says, next one here is, do cadmium and lead get absorbed by the skin easily? What are the possible ways of getting them into our body? So, to my understanding, lead is very easily absorbed through the skin. Once upon a time, when there was lead in gasoline, and my understanding is, if you have a lot of grease on your skin, if you're working as a mechanic or in some kind of construction field or something like that, you have a lot of grease on your hands, putting some gas on there, give it a rub, the grease comes off really easily as gas is a really good solvent, which is generally not a good idea, and I definitely don't recommend that anyone does that, but apparently that used to be the thing. My dad's been in construction for like 50 plus years, and he was like, oh yeah, we used to do that all the time. It's like, oh man, just anyways, hindsight's always 2020. So once upon a time, that was actually probably a meaningful way by which folks were getting lead into their bodies through exposing their skin to lead. Not everyone by and large, but in certain professions or whatnot. So yeah, lead can definitely be absorbed through the skin, to my understanding. With cadmium, I'm honestly not sure off the top of my head. I don't know. I don't know that there'd really be a whole lot of cadmium exposure through the skin. I mean, like there could potentially be lead contamination in water. So if someone's, bathing in lead contaminated water or showering in it, then that could be problematic. With cadmium, I'm not really sure that it's something that our skin would really come into contact with anyways. That being said, my understanding is that cadmium's a significant component in stained glass. I think it's, if memory serves, I think it's in the pigments that are used, like the actual stain, and that is a way that one can get cadmium levels built up in their body, possible cadmium toxicity. I'm honestly not sure if that's from inhaling or if it's from getting through the skin. I'm really not sure off the top of my head. So I would ask Dr. Google about that one, because I'm not sure off the top of my head. If anybody happens to know, and want to save us all a little bit of Googling, please post in the comment section, but I'm not sure off the top of my head. And just check how I'm doing for time here. Okay, still have a couple minutes left. So the last one here is about the safe and sound protocol. So kind of the polar opposite end of the spectrum, chelation therapy, just, right in the weeds of physical therapy. Safe and sound, much more, mind body, kind of well, it's quasi-physical therapy. But anyways, a little bit of a polar opposite in my opinion. So the question here says, I have come across info that Unite, which is the company that facilitates the Safe and Sound protocol, they run the app. That Unite recommends for those that are sensitive and moving slowly through the Safe and Sound protocol, it could be an option to do the first 15 to 20 minutes of each hour of the SSP, and then starting with hour one and then gradually moving on. And then anyways, the punchline here seems to be, so would you just do the first, because this individual mentions here that, they're doing 2 minutes per day. And so with the Safe and Sound protocol, for context, it's a 5-hour protocol where a lot of folks will listen for 30 minutes a day or 30 minutes a few times a week, or, there's different protocols out there. But they'll listen, in 30-minute chunks. So you get through that 5 hours within about 10 listening sessions. If one's going through it only at 2 minutes a day or per session, then of course it's going to take a heck of a lot longer. So what's being asked here is, can you, there's some recommendation where if you're going through it really slow, maybe just do the first 15 to 20 minutes of hour one, then 15 to 20 minutes of hour two, of hour three, hour four, hour five, and then kind of like skip the rest of it so you can kind of like get on with the process, so to speak. So it's a great question. To be honest, I haven't recommended that to any of my patients, but just kind of like talking it through. I think that as long as the SSP is being tolerated, then if my patients go through it sort of at a faster pace, it doesn't seem to be a problem. I also have patients where they'll do, say the first like 1 or 2 hours, and then life happens, and then they don't circle back to hour 3 or hour 4 until maybe like a couple months later, a few months later, and they're able to pick up right where they left off. In my opinion, what I would tell one of my patients is that as long as they're tolerating it well, then I don't think there's any problem with that. I've had other patients, because with the Unite app, you can actually jump to whichever hour you want. And so I've had some patients where they accidentally started with hour 5 and they were fine. So I think it's okay as long as one is tolerating it well. But obviously that will be on a patient by patient basis, and they should ask their healthcare provider about that. But by and large, I don't see any glaring issues with that. Thank you for the questions as always. If you have other questions, please post in the comment section below, and I will do my best to answer as soon as I can.